I thought when there was one warranty, everybody had more time off.
I bet.
Just with more work to do at home. There is one rule line of business session minutes here. Like the status policy, according to the ratings. Minutes is 2024.
Where do you see that? Yeah.
It's on the minutes, well, February 24th, paragraph about old business. That's what's going on with federal land. Already. Your sign seeks forever.
I think it's 5 o'clock and we'll go ahead and get started. Are you able to hear okay, Dr. Miller?
Yes, I can.
Okay, great. The first item of business will be the approval of minutes, and we have sets of minutes to do. We have the February 24th set of minutes, and then the May 13th, it was an executive session. So we will give everybody a chance to look at the minutes for the May 24th. February 24th. And there's no items on there. I think there's a motion to accept.
So moved. Second.
Any other discussion? They will and approve. The other set of minutes is for May 13th. It was an executive session.
Move to approve.
Okay. No one else was here. People that were present was Riley Gregg. Oh yeah, Dr. Gregg. Okay. All in favor say aye.
All right.
The 2 sets of minutes were approved. We will get brief updates from the food, then nursing, environmental, and vital records. Brief updates going with the food division first.
Basically, just have to share that Del Carr left, and
You have to come over here so that they can hear you on.
Del Carr left in March, and right before the coronavirus actually got busy, we hired Scott Kuykendall. He's been with us now about 3 weeks. He came from Marsh North and Needlers. He was out there 37 years. So there's really not been a whole lot going on in our department because of the COVID. Dr. Moore had me assigned to other duties. So I was busy in the office right along with everyone else. You guys have any questions?
I'm sorry, what was Scott's last name?
Kuykendall. Kaikendall. Correct. And he's not here tonight. He had a previous engagement, so he should be here on the next one.
It brings up a interesting point, because I think we talked a little bit about this in the past. Is there a formal orientation training period that he goes through?
I can't say it's formal, but it's basically the same thing that I went through, that the state guidelines for us. And basically what it is you get your food book, you learn it, then when you feel comfortable, and during that time, as you are learning it, you're filled with a experienced person. Then as you feel comfortable, then you start taking it over from the experienced person. Experienced person is still working with you, and then when you're ready to be cut off on your own or doing your own inspections, then you start generally between 3 to 5 months. That's when a person is out on their own.
Thank you very much.
Mhm.
Nursing manager? Been doing a few things.
Just a few. So just to give you an update, today we have 324 cases, 24 deaths. Our case count is going to differ than the state map due to we have been instructed to count our clinical cases, but when you look on the map, they only count confirmed cases. So we haven't changed that because we haven't been instructed to not count the clinical cases. I know everybody that does lab reporting has to do the clinical cases because the hospital counts them as well. So we've been busy since our first case of March the 19th of the case investigations, contact tracing. Since then, the week of May the 18th, the State Department of Health has gathered about 500 people for a call center, and they do the case investigations and the contact tracing now. When we're trying to do our best as far as what's going on in our community, the hospital works well with us and letting us know what they see through there. And we continue to get phone calls of people that have questions. So really that's what we've been busy with, doing all of that and helping the interns by printing the case investigations, modifying those names, and gathering the individuals that Dr. Moore and the interns are interviewing. Those are people that we have previously been in contact with all the contact tracing that we had done. So we compiled some names for them to contact those people for their interviews, phone calls, and we do daily reports on WBAT every morning. And we're just been working along with people in our community as far as the hospital and long-term care facilities. You guys have any other questions for me?
Any questions?
And we are taking appointments. So we've already been immunizing kiddos and administering TB tests again.
Okay. So you're doing good.
Yep. They have to do it by appointment only. We don't take walk-ins, so we can make sure we don't have too many people in the waiting room and we can get people out before we bring people in. Thanks.
I know that you've been busy. I've seen and heard you a lot. Yeah.
Thanks.
Environmental division update.
Really don't have a lot to say. Being off, I was off for the 3 weeks. Septics are just now starting to go in very slowly. Not real sure why this is happening, but it is. I think we've only approved 3 or 4 as of right now. We should have had a whole lot more than that. The weather has been decent. They're just not going in. But the housing complaints are going through the roof. We've got so many housing complaints coming in that it's hard to stay up with them all.
And what's the general complaint?
Filthy houses, no water. We've posted one house twice as uninhabitable, and so has area plan. And we found out today there's somebody living in there again. They took our signs down. So we went back today and posted that they won't answer the door and talk to us. We even had the police with us and they won't do it. So we put up our second set of things and we'll see if they take them down this week. So other than that, that's all we're doing.
Any questions?
Thank you.
It says no old business, but on the 24th, the minutes of the 24th, it talks about the cat bite the victim, and so the current policy and procedures were discussed. Amber is requesting the board set forward protocol for animal bites, and Dr. Pearson will edit and present a document at some point.
Yes, and it is actually, the draft is completed, I just have not.
So I suggest that we put that on as an old business item for next time, and then get the draft. Once it's
Yeah,
typed
then
in.
can I email that to you you so that it can be perfect. And that's what I will do.
Material, give it to me.
Okay, so that will be on hold. New business, that's, Annie Vermillion to come in and talk about the internship program that's going on. There's been a lot happening, over the last, few months. And so we've asked her to come and talk about that.
Good afternoon, everyone. Morning, afternoon. For those of you who don't know, I'm Annie Vermillion, lead consultant with Vermillion Group. I'll take this off so it's easier to see, so I'll try not to. So I'm helping the health department with the summer internship program. We have 4 students ranging from pre-med students, health policy, administration students, and public policy students. And they are working with Dr. Moore. Our goal is to, 2 different goals, to have just a meaningful research project for them this summer that they can take as they go on to their healthcare studies. But a double win is that we will have more expanded testing going on in Grant County. What we really wanted to do is they researched, and we're going to be executing a CDC Behavioral Health Questionnaire that will also go with it. So I think a little different from the Optum sites from the state. The state will ask a few questions about travel patterns. Our test follows the CDC Behavioral Health Questionnaire. So as we're out into the community, one will have 2 different things that they can get tested for the antigen to know whether they have COVID at the time they took the test. They could get it 10 minutes later, but at the time they answer those questions, we'll know whether they were positive or negative. And then we also are working with LabCorp to pass out antigen or antibody testing that they can get on their own time at LabCorp, but that the health department will also get those results. So the goal is the win-win in this research project is that we will have a CDC behavioral health question with the actual answers to do they have COVID at the time they answer the question, and then also do they have the antibody. The third portion of what we're going to do is we've also had all of Amber and the nursing division's research that's come in from those that have tested positive. So they are already working on a presentation for you so we can kind of see what are the demographics, what is the zip code analysis, and just some data that we can have on that. The second data research that they're going to present to you by the end of the summer is also a focus group, some more qualitative information. So we currently, right now, the students with either Dr. Moore or myself have met with already positive known patients, and we're getting some wonderful data of their take of being a positive patient. So we've looked at patients that are asymptomatic and were positive, patients that had mild symptoms and stayed home, patients that were positive that had moved into critical care or some sort of hospitalization. And then we're also working to maybe work with patients that have had family members that have passed away. But currently the kids are doing synopsises on those interviews and finding some trends, and it's pretty fascinating. So that's just a little update. We have 3 testing sites. We're going to do a test trial site and an industry later this week to just work our processes before we go public. We're going to do one at Gas City on the 24th, Oak Hill on the 30th, and St. Paul Baptist in Marion, Indiana on July 7th. Our goal is that we will have about 100 questionnaires with those behavioral health questions to really provide you guys some really neat insight to how they answered it compared to what the outcomes were. So that's just a synopsis. Is there any questions? I think you, Dr. Moore, I think we were looking at both, right? Ordering which antibody test?
We're LabCorp is doing IgG and IgM.
So I thought our goal was if anyone was interested in the antibody that we would order both tests so we could see the IgG and IgM. And the residents of Grant County can go get that done at their own time. They'll have a lab order from Dr. Moore, so the results will come back to both the health department, but also for the students, the research project.
Do you have a goal in mind of, like, let's say that
Well, the ones that we already know were positive, I think we had, Amber, I'm not sure, we were analyzed out of 164 before the questionnaire started moving to the state. Is that correct? Right. So the kids will only be looking at the questions that they answered through the state questions and through our health department's questions. But there's some really intuitive, really neat information just with that first group of people. So those would have been from Amber's first, I think the first test up until a certain date. So we're really looking at 3 different presentations that the students are going to give you. They're going to give you some analysis and pie charts on the very first test that we know were positive, but they've done some questions that were similar to the CDC questionnaire, but we haven't given them the full CDC behavioral health questionnaire. The second will be just a focus group analysis, and then the third will be the testing site. So all the ones that we have at the testing site, you'll get the data plus the 3 or 4 minute survey, which goes into a little bit more depth. Like it goes into how often did you travel the state, the city, the country, before like from December to March, and then the second question is March on. How often did you wash your hands? How often did you wear a mask? How often did you travel to the grocery store? So we'll get to see travel patterns versus whether they use PPE, whether they travel to the state. So it'll be some really interesting data that we have come back. Plus we'll also have the age demographics. So you'll have zip codes and gender demographics and age ranges. So we'll get an idea to see what that looks like.
These testing sites, are these specific population and other people be referred to these testing sites?
We haven't put any stipulation. We just want it to be an ease of comfort on 3 sites throughout the county. Our goal is if this seems to go well and they have enough data, we could possibly with this first group of students try to sprinkle out Fairmount and maybe Van Buren and get more sites under this research project. But at some point, these students are heading back to college, so I wanted to have just a date that we could get the testing site, but they could also have a couple weeks to work the analysis and then present back to you.
We have information out to people about that they can give setting things up, but if you don't have that information out, people don't.
Yeah, so it just kind of went out on Friday at 4 o'clock and then today. So we've had it on the radio, it's on social media, and then tomorrow we're working with the students on an increased communication plan. So they're going to be executing their communication plan to a greater detail as we meet tomorrow.
Will it be on the state side as well?
State site.
Yeah.
I'll have to check on that. I mean, we haven't coordinated with the Indiana State Department of Health because it's opposite, or it's not opposite, it's just, it's not in coordination with the state's Optum site, right?
But my understanding is the state still requires all testing before the students, right? All positive? Like at one time I thought they were doing all tests.
They want to know how many people were tested. My question is, to use this data, is there an IRB or is there a release for people who are part of this research?
Yeah, the very initial part, which I think we sent to a couple of you, there is a understanding of that they're entering into a research study, and they have to also understand that their analysis, the information that we try to capture the information to be sure we can correlate it to their test, is in a completely different section than they start answering questions about behaviors. So we very intuitively put at the beginning of it that your answers below this survey will not be linked to you personally, but as a total of the county.
But it hasn't gone through an official IRB.
We have not gotten that done at this time. The goal is that maybe as we expand, we can kind of move into an IRB.
Because IRB is kind of the gold standard to publish stuff. I mean,
Yes.
Informally for us, but we can't really publish stuff without
Yes.
an IRB.
So things have been moving so quickly. On my one task is to touch base to see if we couldn't get this IRB certified or even through an IRB. So it would be perfect. I know you and I have talked about that. Haven't made the connection yet to get that done.
Any other questions or comments?
Great, we're excited. Thanks.
The next item, Dr. Moore, you wanted to mention something about the school system, or that was the next item.
So I want to first thank the staff. It's been, from the time COVID has started, it's been just, the health department in the middle of it has been up and down, and the department has stepped up and appreciated, and especially to Amber and Tara and to Dean, who's been critical. All of the staff have been helpful with it, but those three especially have stepped up in the midst of this all going on. And I set Annie up here and I gave her a moving target, and so she's trying to get it. So I'll try to address some of these questions and the what and the why. David came here with us. We asked him to be here today, even though he has another appointment. And many of the things, David, we've already talked about. So if you need to go, we'll understand that. But we'll have another meeting in which we come along with that. Thank you for coming. Okay. Yes. So I want to thank you all for coming today, and for our staff that was here. The world got turned upside down when COVID hit, and we had this planned out for the year, and it just came and has totally dominated the agenda as an absolute rapidly moving target, and including to the point that the department, that the building shut down and only essential workers were here. And we asked, when the building shut down, for those who weren't here, if they would take on a project to do something to make themselves or the department better as they did it. And Tara took just trying to breathe through all of the things that were coming at her, because she was essential. Amber was collecting the data as they were coming in. And when we had our first case in Grant County, I made the mistake of, I got a call saying we had a case in Marion, and I said, we have a case in Marion. It was Marion County, not Grant County, but it wasn't shortly thereafter that we did have our first case in Grant County, and they have grown and they've continued to grow since then. Then we had our first death. We had a first case in the long-term care facility, and everything has been changing. We've been tracing and dealing with it and trying to understand. We were doing all that we could just to contact trace and stay in touch with them. The data was reported to the state, and the state has let us know that they're not going to have any time to analyze what went on and what happened in our county. And so we went to the plan of how do we reopen America, first from President Trump, then from Governor Holcomb. One of the things that they'd asked is that you can begin to open when your health department can rapidly assess if there's a surge in it of what's going on, and can do testing sites to go with that. And so we look to have that to be done at the same time that some of the kids who are going away to college says, can we do something with the health department? And to see, can we have the students help us to set up a department? Students who, a non-paid internship that they have because they're interested, they're from Grant County, they're promising students, and we wanted to look to see, can they help us working with the EMTs as the professional doing it, set up a testing site? Because at that point, the only place to really get tests was at the hospital. And I'll talk a little bit more about the role, the incident commanders, if any of you are familiar with the National Incident Management System, and this was where Denise was intimately involved in. Dr. Miller is also intimately involved in that system. It's a command system for how to deal with any incident, from a reception that you're having for the governor coming town to dealing with a major terrorist attack. But at the top of it, there's an incident commander. That is not necessarily the person who's hired to be in that position, but the person who has the greatest command. And to that, he assigns people with different equipments. For example, Dean was in charge of the ones to take care of our personal protective equipment, and to make sure that we had supplies and know where they were there. And each person had a different duty to do with that as we went along with that. Dr. Dean and I were the incident commanders for this in a unified command. Dr. Dean and Dean Rick's in charge of the hospital, mine in charge of the public health thing. brand new there. And I was on the phone with Dr. Renfro and Dr. Erke, and I think we talked with Dr. Miller about what do we do, because this is our first rodeo, and how do we learn it. And the testing that we had that President Trump was, and that Governor Holcomb was asking about, is about the ability to do it. We started with a very limited supply of tests, and the hospital had a perspective. If you show up at the door and you've got a minor cold or cough or other sort of things, you went out and you went home on quarantine. If you came into the hospital, that's when they needed to know when a COVID test was done, and we had a limited amount of supplies, and that works for the hospital. As we came and flattened the curve and that brought under control, then we shifted to a public health perspective of what do we need to know to keep the county safe. And this is a very different perspective than what we have with the hospital. What we want to know is, where is COVID in the community? How is it spreading in the community? What is doing with it, and how can we collect that data? And so I asked Annie if she would take these students who were out of school and help them to build a testing site. Right in the midst of that, Governor Holcomb said, we're going to give you Optum. And so now we had an ability of hired people who were specifically made to do it. Our people had a full-time job before COVID came along. We had a full-time job after COVID came along. So we could not fully sap off from that. And he took some students and had led them on this moving target, because Optum came, but they were just a mini version of the hospital in terms of their criteria. They loosened up their criteria, so the objective of Annie shifted. And then they now said, as of today, that if you want a test in Indiana, you can get a test. You don't need a criteria. And so now what we have is Annie now is leading a group of students where we want these students who are very talented people to know how do you, from the ground up, what is the why, not just the what, what's the why behind what's going on as we set up a site. Why are you looking at these issues? What are the questions that you want to know? And we gave her lots of people that she can go to for answers, but she and the students have had to build this from the ground up of this. And then they're going to have a testing that they're going to do. Now, before it was to get massive data so that we could do what the president asked when we open up. If seems to be an outbreak, do we have the institutional knowledge to build a rapidly expanding sort of site? And it has moved to, how can we have these students have this experience and know what to do? How can we take the data, both that we collect from there, but now as of last week, Optum is providing us not just with tests, but they're providing us with meaningful data. So their goal has shifted again. We're asking Annie these questions because my instructions to her have shifted, that her goal has shifted. So how can we take this data? How can we understand where in Grant County this infection is? How did it get there? How is it spreading? How do we understand it? Is there a disparity between certain segments of our community? The national stats and the state stats is that people of color, Black and brown, have multiple times the infections and multiple times the death rate when it occurs. So what's happening in Grant County? And can we understand why? And can we use COVID as a lever to get people to look at their health practices? And is there something that they're doing? And can we use COVID to begin to monitor that? And that's one of the tasks that has been assigned to Annie. And then to say to the state, why, what's happening in Grant County? And when she goes back in December, what did we learn about COVID as it went through our community? What happened in the spring is different from what's happening in the summer. What's going to happen in the fall? Not just what, but why? And can we understand patterns? So she has students that she has starting in May that they'll go until August, and they'll finish up in August and go back to school. We want something that's big enough to make a difference, small enough to be doable. And so that the package that she's working within is, what can these students have a successful, meaningful experience by the end of August? And how can we as a health department be better? And how can we know more? Then come the fall, and this is first time being done, so every lesson that we're learning is a new lesson. So then that's the time when we start looking at stable students. Can we get an IRB? Can we get an investigational research panel board looking at what we're doing and guide us with the questions that we ask, so that we can do that? First have to see, can we do it? Then can we get them involved in it? And can we get small enough to be doable, big enough to make a difference? What data can we collect and understand from Grant County as we go through that? So again, I apologize for you because the target just moved. So, but the students have done a fantastic job. They're very enthusiastic about the questions that they're asking, and they're being involved. And the department, for when they've gone to people in the health department, have explained to them, when they ask a question, they ask that. But the students are learning and very enthusiastic that as they go to their next level of learning will be good. And I think my goal was to get the health department into the community. I want us to get us out of these walls and involved with people in the community. One of my goals also is in my community where we do suffer with Black and Brown, that we do have issues, that we use the health department to understand those issues and to help us, not just in health, but in quality of life to doing. And so as we go into the minority community, and one of our centers is going to go from the YMCA, where Optum is, to Faulkner Center in the inner city, and can we ask meaningful questions of them? Can we get their statistics and understand why that is different? That it is, and this COVID is not just a virus. It's human beings and their lives are being tested. And I sat in on Friday with one of the students, and the couple came in, and this gentleman said he's healthy, doing well. A few days he was not feeling well, and one day he had a headache. One day he had a headache. The nighttime came, the headache was so severe. He said, "You got to call an ambulance." This is a guy who never gets anything wrong. He's in his early 50s, and he said that somebody just turned the light off. And for a month, he had no recollection of what went on. He had seizures. He they had coded, and he was resuscitated. He had blood clots. The family was separated, and the nurses were kind enough to put him on FaceTime. He had the warrior walk. That is, those who've been in the ICU, when they get to leave, to come down. And his wife saw him. He has no recollection of it. But to her story, she was there too, of what was it like? How did COVID affect us as people? And what were some of our experiences? One of their frustrations is, she said, "I'm with him every day. Can I be tested for COVID?" And the answer is, no, you don't meet the criteria. Not that she needed it, but emotionally, healthcare, in my mind, is not just about taking care of your health. It's giving you health reassurance, helping you to understand what and why is happening to you. And what she wanted was health reassurance. He wanted to know, my son, who went through a strange illness around the same time I did he have COVID? Can we do antibody testing for him? And his primary care said, no, you don't meet criteria. You don't need that. And that's the difference between the hospital, when you take care of them there, and the public health area, where is our domain. And as we've gone through this, I've developed what I think is an understanding of the difference between those two, and what are we looking at, and what we're responsible for. And now that we're reopening, we now have institutional ability to, I think we have the institutional knowledge that if there are people in place, if we needed to be called upon to rapidly do that, we have people who've gone through those exercises, and we can pull them together and we can do that. We have some knowledge that Annie will be analyzing for us, but we also have the ability to respond that way. Do we understand what goes on? We're going to understand more as it happens along the way. We were invited to Carry Services to look at what is their setup that they've had to prepare to reopen, and have the health department make input, make commentary on what do we think. We went to the courthouse and to look at what is the situation that they have, that they set up, and what input would we have. And in one of the places that we visited, a couple of days later, they called us and said, we have a positive case. What do we do? Now, this is pie in the sky that we were talking about before. Now, this is on the ground, and the person had also been in the county building and maybe had exposed people here. That person had also, they thought, went to City Hall. And what's happening here with it? What do we do? And how can we as a health department, not as the hospital who has a person presenting there, but looking at the overall health within the community, what kind of guidelines do we have with that? And brings us to one that just came up last week. And the Department of Education met with the school superintendents and with the State Department of Health. And we're gonna open up. Want to remember that this is a medical problem that we have, that there's a virus that's still the same now as it was in the spring. We have a human body that still has the same capabilities. So there were some logistic things, separation, shutting down, social distancing worked, but we can't run a country like that. How do we reopen? How do we safely reopen? What is the new normal that we have as we go forward? And my belief is that it was the mixing, it was the big concert at the football games, it was the schools with the kids going about and interacting with one another, and they were picking up things and bringing it home to grandma. And then grandma was the one that gave us these. How many deaths do we had so far, Amber? How many deaths? 24. And it was, I think it was the kids who were doing that was causing that to occur. They're going to start coming together again. What kind of guidelines do we as a health department give to them? And I am the health officer to do that, but I work with the support and with the consent of those of you to say that. So what kind of guidelines do we give to the state? What do we recommend? And we want to make it not emotional, but we want to make it evidence-based. We'll acknowledge that there is currently, we'll just name it, politics of COVID. And there are two very, very distinct and separate philosophies. This is a bad case of season of the flu. We need to just kind of chill. It's going to go through. We need to build up our immunity and we'll be able to get over it. Another school, that this is a virus that's multiple times more infectious than anything that we've seen in my lifetime, probably in the century since the Spanish flu. This is a virus. It's more contagious, more infectious, and it's more deadly if you get it than that. And the body hasn't changed, and the virus hasn't changed, so that we have to move on to a new normal. Which is this, and which of these camps that you fall into will determine what do we think is the appropriate response that we make as we open up again. What I use as my motto as I go forward is something that happened in our community. We had community spread. What community spread means is that it's out there, but because we haven't tested, we don't know where it is. And so we had a boom and a boom and a boom, and an infection popped up, and it popped up because we had that hospital mode of when we present to the hospital, not a public health mode of what's going on in the community and how do we prevent it. And so we had community spread, which in my mind is saying we haven't tested to find out what's going on with it. And we had a long-term care facility, several of them, and you've seen them on the news, where in these long-term care facilities, they were just like a death camp in terms of how they were dying in some communities and how bad they were. Fortunately, in Grant County, we only had one nursing home where we've had these occur. And in that nursing home, there were infections that were popping up. And they were doing, to the best of our knowledge, they were doing the right things, keeping clean, keeping the other things that they needed to do, but they still had the hospital mode of testing. And finally, somebody said, why don't we test everybody to see what's going on? And what they found is that 1 in 5 of their workers that were coming in were COVID positive. And the residents were getting sick because these well people with no symptoms were probably spreading in it. And it said to me that we can't manage what we don't monitor, that we need to reinforce my point of view, that we need to know what's going on and what's happening with it. The state brought in some tests to do us about 2 months now, and they were collected at Marion General and other places, statistically proved by the public health school at IU, and 45% of the people who tested positive for COVID in their either their culture or their antibody test had no symptoms, no fever, no anything. Now, if you drill down, you may find that they had a day where they had a backache or food tasted funny, but if you ask them, they had no symptoms. And if we waited until they have symptoms, we miss them, and we get what we call community spread of asymptomatic. And I think that all our tests are not perfect and they have limitations. And Annie said it tells you where you are right now. It doesn't tell you where you go in the future, that it's either that we don't go from total darkness or total light. Either we test nothing or our tests have to tell us everything forever and always. Maybe we might turn on a 25-watt light bulb from total darkness and we get a little bit of light and we get a little bit of understanding. And as we grow and know and understand more. And so as we use that as the schools begin to open up, what do we recommend? We have testing that is as best as we can tell. Now, all of the tests that we have for COVID, we did not know as a medical community anything about COVID a year ago. And all of the tests, all of the things that we're doing are brand new, and we have they're given EUAs, emergency use authorization. That is that the FDA and the CDC has looked at it and said that in this emergency, this meets the minimum criteria, so we're going to authorize you to use them. And we're going to know more, and they're going to be more effective as we go along. And so as best we can tell, the culture there, the initial culture was you culture the back of the throat, you do a brain biopsy and go up in here, and then you get a sputum, and that was what required. And anything short of that, either total light or total dark, anything of that was not acceptable. And then they went to get rid of the sputum and say you just have to take a brain biopsy. To now one of the tests that the hospital is running is just a general nasal swab that's done in saline and can be done. So we can get good knowledge about what's going on in our community. I just met with LabCorp this afternoon, and their antibody test is their sensitivity and specificity is above 99%. Now, remember, this is emergency use authorization, and once the FDA looked at these numbers, they may not look quite as good. But as best can go on now, that these are very, very accurate tests, so that we can know. When we test for antibodies, and I think you asked the question, which of the antibodies that we take, and there are three things we could have: IgM, IgG, immune globulin M, immune globulin G, immune globulin A. This is the body's defenses that builds up against it. Immune globulin M is sort of like, for me in my mind, it's police and soldiers. The immediate situation that the police respond, but over long term, the soldiers that are there. And so we can look at the antibodies and say, does this look like a recent event that occurred, or is this something that occurred long term? We still don't know if it gives immunity, or if it does, how long that it gives. We have had a test at Marion General where we got some from the national and treated a person who was in ICU and critically ill, and within 48 hours they were out of the ICU and doing well, so that the antibodies help that person do better. What does that mean? We're going to know more 2 months from now than we know now, but we use the best knowledge that we have right now. We can know where the infection is, we can know where it's going, and we can test. As we start to open up the school system, we can test and know. So social distancing we talked about, shutting down, really does work. And how likely is a group of 12, 13-year-olds on a bus going to do social distancing? How likely are 12, 13, 14-year-olds on a bus or throughout the school system going to have a mask on? But if we know that everybody on that bus, we know their COVID status. And we know it as of right now. That's not the same as if we were measuring them. In the White House, they measure once a day, every day. We're not going to have that ability to do. But Optum has told us if we needed to repeat it again, as long as your previous test has come in, you can be tested again. We can test repeatedly to find out there's no longer a shortage of testing equipment. We can know everybody that's on my child's bus. We know their status. And so if he's not down, sports are going to come. Contact sports haven't yet started up. Contact sports haven't yet opened up by the state. But if my son is playing on a team and there are people that are there, I can know all of the people, the coaches and all of the players, what is their status. And if I check them back a month later, I could know that I can test everybody in the sample and say that if these index cases say on this bus, there's now a positive, then we can potentially test all of the kids on that bus and find out who else is positive on there. We can do beyond that. We do contact tracings on them. so that anybody that they're, so we isolate the ones who are positive, we quarantine the ones who've been in close contact, but we can check their home and we could find out who else in your home is positive. We can check antibodies and say, is there somebody in your close contact that this came from? And we can, as we open up the school systems, we have the ability with knowledge to do that. As a health department, what do we want to do with that knowledge? What do we want to do with the ability? How do we want to guide our students as we go forward? We can use the model that is traditional. That is, if you get really sick, you're really sick, we test you for COVID. If we happen to find out from some other way that you have COVID, that you have COVID, then we know that you have COVID, and so we isolate you. Isolation means that I have it. Quarantine is that you've been affected by somebody that isn't alive, that I know that I have it. And for 14 days after, and Dr. Renfro could help me with this, 14 days after the index case of where you tested positive, it appears that you're no longer infectious. You still may have viruses that may be detectable, but you're no longer infectious. So we can do that and just isolate and let it go with that. Or we can use data like they did at the long-term care facility, and we can make informed choices. We can make knowledgeable decisions. This is a big step that we're looking at. Do we want to go beyond the traditional and do more? And if we do that, I would like to have the health department to have more than just this few minutes that we're going to have here today. And let's look in depth at that. And what do we want to do and how do we want to do it? And with that, I'll stop my monologue and take questions. Yes.
Have you had any communication with the various school programs? What their plans are and if we could plan?
So Amber and I, with Bob Jackson, listened to a WebEx on Wednesday that we had heard about at a meeting, incidentally heard about at a meeting on Monday, that the superintendents had gone to the state and the Indiana State Department of Education, had met with them and given them some suggestions of how to open up. And the state health department was there. And the state health department, when they asked, so what do we do with this medical aspect? Remember, this is a medical issue. It's a virus in a human body that behaves a certain way when they get together. What do we do about this? And the state, they said, because Amber and I weren't there, they said that they refer you to check with your local health department, which means that we're going to have 92 different health officers giving guidelines to it. And do we get in line and follow what they've done? Or do we as a county make a thoughtful approach to what do we feel is best for the people here in our community? And so, so that the schools at that meeting, they agreed to get the schools together and look at best practices. And in July, they will call the health department back in that. And what we may want to do is that we may want to communicate with those schools and say to them, and this is a thought that I'd like you to think about, we would like to hear what your plans are so that we as a health department can give orders in how we're going to open up the school systems again. We can wait and let them do it. We can tell them what we're going to require of them, or even better, we can have a conversation. But having that conversation in July is too late for us to do that. If we're going to do that. And so if we're going to do that, if we're going to have that conversation, we need to move expeditiously. We want to move thoughtfully, and we want to move with the humility of knowing that there are lots of things that we do not know about this virus. It seems to be behaving now differently than it did in the winter. We've opened up the country. We started social interaction here, and we haven't seen what I thought we were going to see as a big surge in cases. Is it different? So we have to be humble enough to say that the things that we don't know and that we're going to learn about this as we move forward with it. To say, but we're going to give our best medical judgment of what goes on, and when we know differently, then we advise differently. So yes, there has been a conversation, but this is the reason I'm bringing this up is that if the health department has been tasked, one of the 92 departments that has been tasked with that, what what is your advice as we go along with it? And because it's going to have legal implications, that gentleman right there is there to keep us safe, to keep us on track and to keep us safe. Didn't put you to sleep, did I?
I just want to make a comment that, first of all, I really speak. I think this is being proactive instead of being reactive. And I think your approach about having a conversation with the school system is critical. Because, yes, as a county health officer, I know that you are empowered with certain authorities being in that particular position. There's a delicate balancing act between having the authority versus at the same time having the support of the community. I think the approach that you're taking to that conversation is very.
They know where I live. So I have to be careful what I tell them to do.
I'm concerned that if we have, because we have 5 different school systems, wait for them to have 5 different.
And of necessity, they're going to do that. Some schools, for example, have auditoriums, and they can have lunch in wide out spaces. Other schools don't, and their lunches of necessity are going to be served differently with that. And the resources and capabilities, the physical resources and the staffing resources and the expertise differs from that. So what the school systems have talked about doing is getting together. At Wednesday, they talked about that, getting together and coming up with a plan. The reality is that these 6 different schools are competing with one another for students, which is competing for tax dollars. And if one system has a more attractive sort of thing, they want to, for example, have the school open for 3 days and telelearning for the other 2 days. And a parent says, I need a babysitter 5 days a week, so I'm going to move my kid to a school that has it 5 days a week. And that school that they win lose revenue the one that gets it. They will put a billboard in your town on your main street right next to your school saying, come over to my school. So the schools are very aware that if they're going to do this at this time, that they really need to be on the same page. And they really need to basically be doing the same thing. And so they're going to try to come up with a consensus of best practice, knowing that they have different physical facilities, they have different staffing facilities.
You also have different counties, so like Madison Grant actually is a different county. So that county health board decides something. It impacts the students that live in Madison.
Still has the same thing with Miami.
Right, so, I mean, there's more than just everybody in this county and others as well. And you're on a 6 weeks or 8 weeks before school opens. So I don't think we're going to solve it tonight. I do think that these are discussions that we're going to have outside of this meeting. I mean, we'll have to call another meeting because it's going to take a while. So I suggest that we have a budget, but we also have to. So we can't not do the budget. So I don't think we're calling for action right now. I think this is kind of like the landscape. There's something to think about in the couple of weeks.
And if any of you have issues or questions or thoughts outside of this meeting, please give the input so that we can together think of this and come up with the best thing that is the healthiest for the kids, but is also politically palatable to do. Okay. Thank you. Thank you.
So thank you, Dr. Moore. Now we have 3 budgets we're looking at. We have different documents. Now, is this the actual, we're approving these budgets now for the, what is this?
That is the budgets, what we actually spent in 18 and 19,
Uh-huh.
what we budgeted for
money, and then we have to turn in our budget requests by the end of this month.
Right, that's what yeah. But we don't know how much of the 2020 budget that we spent yet.
Correct.
Are we on track?
We are. There are a few areas where at the moment we look like we're not doing well because we've spent funds that will be reimbursed by CARES Act. Okay.
So make sure everyone's good on the budget.
Oh,
Because the budget last year went up. No, the total budget went from 520 to 545. So, but we don't know if that's enough or not enough. We don't know what we've spent.
we're not, other than the few areas where we have spent unbudgeted funds that will be reimbursed, our budget's healthy, we're in good shape.
But is it too healthy or is it not healthy enough?
Oh, I see.
Like if it's way over and we're not going to end up spending 500, if we're going to end up spending 500,000, then we need this. Dr. Miller, did you get the documents?
Yes.
The only place there's a potential overage is the Prevention of Disease Fund, which is for situations just like this. So it's a big cushion every year, and the council knows that, but it's there so that we are prepared when there's an issue.
And then we're working with the CARES Act to be reimbursed.
For unbudgeted funds that have been spent, there was a lot of overtime, especially during the shutdown. That's money that will be spent to pay employees, but it will be reimbursed by the CARES Act. We've spent some prevention of disease money for some testing that was done for uninsured or underinsured individuals. That will be reimbursed. Anything that we've had to spend that was unbudgeted and COVID related will be by the CARES Act.
And you said there was a lot of overtime going on.
Anybody that was required to work when the building was closed because of county policy, they will be required to pay them an extra time and a half. So they'll owe everybody half, or they do owe everybody that had to work during that additional pay.
So let's talk about the Grant County Health Fund. You want to keep it level? Do you want to increase it? We have no recommendation. So
My recommendation is that we stay where we are now. The funds into the county are going to be down. So that there may be, that the council may end up cutting back on some other things that some of our resources may ask us to do that. The suggestion is that we stay with where we are. The rise from the last year was primarily that people got to pay raise. But most of the expenses that we had were the same. One of the things that I didn't mention was terrorism, the preparedness budget that we had. Terrorism. And the amount that we got from the state, the way it got distributed varied, and we have now a new person doing that. So that amount changed, and the salaries changed. But most of the requests that we had for this year is the same, but the year is so very different. My recommendation is that we make the same request and adapt as best we can to what's coming. We reconcile where do we have excesses, like I said. We may need it more. But just a note that if you ever turn the money back in, based on history, we won't see it again. But if we don't, we did it. Other than this, we comes out of the same.
it's all our tax dollars. It's all our tax dollars. So that's the recommendation. Is there a motion to make it the same? And we're just talking about the Grant County Health Fund. We have three different.
I'll move that we leave the Grant County Health Fund.
Motion and a second to leave the 2021 request at the same level as the 2020 request. Is there any discussion? Hearing none, all in favor say aye.
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 Opposed, same sign. Abstentions, same sign. Okay, that passes. Then we have the local health maintenance fund grant. You see where the items are paid. And that grant is, that fund grant is also, what are you recommending, Dr. Moore?
I am recommending that this grant remain the same. Which is the grant that's going to change?
The one that we're looking at now, it's a $48,000 a year annual grant. And we've had a very large pot of carryover money that we're dipping into each. That carryover fund right now, I believe, is around $58,000. So at some point, we'll have to look at cutting some of this. But for now, the carryover fund picks up what the annual amount doesn't take care of.
The expenses exceeds what we're getting in the yearly grant. And so we're using some of the carryover funds that we have from before to make up the difference in some of those. Which of those ones?
So what is a local grant? What is that?
The local maintenance, it's tobacco funds.
Right, but how much is it?
Oh, it's 48,000 annual.
48,000.
48,200.
And our budget is 81,000. And do we spend this amount? Is this?
No. With the county general fund, if you find out that you didn't budget enough in a certain area, you can either transfer, you go to council and ask for a transfer, or you can ask for additional funds. With these grants, it's a much more difficult process if you run short in one area. So we tend to leave them at the amounts that they are, and we typically don't spend $1 per year.
Okay, so but the 2019, it looks like it went from, the 2020 went up a bit from 2019.
Because we had pay increases that the county passed just across the board.
So you're not expecting that this year?
I don't foresee them doing pay.
So your recommendation is to leave it the same?
Yes. Last year, as this current year.
Okay. With that recommendation, is there a motion?
So moved.
Okay, Dr. Miller moved that we leave the 2021 request the same as the 2020 budgeted item. Is there a second?
Second.
Thank you. Any discussion?
So each year, you're saying that there's carryover, there's a bucket of money that you're carrying over, or that you're pulling from in order to make this budget.
It's carryover that prior to me taking over these grants, we didn't realize this building's so huge. So it was like $180,000 carryover at one point when this budget was set. And we've just, as you can see, we've just historically kind of continued with the same amounts each year, knowing that we were dipping into that carryover.
But at some point in time, that carryover runs out.
Yes.
And when do you estimate that to be?
At the current rate, 3 more years.
So then it sounds like we need to make some kind of action plan
So
because we can't
will be
sustain this
going to
budget
account-
for 40. At the 4th year, we can't sustain this budget.
And where we're looking for it is in our nursing division. Right now, we have 1 full-time nurse and 2 part-time nurses, and we're looking to go to the council and ask that we could have 2 full-time nurses that are there. So we're not dipping out of this grant money, but that the county budget for one before we run out of money with that. And over the course of this next year, we'll be going to the council asking them to give us another full-time nurse that the county.
At this point in time, Grant County funds 1 nurse and grant money funds the rest of it. And I think it's time to go to the, at a pandemic, it's the
This is
first
a great
time
time.
to go to the council and say,
Never
listen,
let a
we need
pandemic
more
go
than
to
what
waste.
the full-time does. So that is our.
Okay, okay. So right now, there's a motion and a second. Any other discussion? All in favor say aye.
Aye.
Opposed, same sign. Abstention, same sign. It passes. And then, but this is the tobacco trust fund grant over on this side. I thought what we were just doing was tobacco.
They're both.
Oh, we have two tobacco.
And I don't understand the breakdown. So I mean, why two? Why don't we just combine the two? I don't know.
And this tobacco trust fund grant does salaries for,
For an environmental health specialist, and a small amount of that, goes to supplement two county salaries,
environmental health specialist.
which is in our environmental division.
Right, and that's, but some of it's over in their local health maintenance. A small amount is over there.
No,
So that's for the part-time.
yes, that's the individual who's hired to help with fairs and festivals.
Okay.
Two people can't do it all.
So environmental health specialist, and what is that position then?
It's in the environmental division, they do the housing inspections, the septic, that type of thing.
So it's not actually the tobacco.
No, it's just where the
No.
money comes from.
Okay, from the money. Okay. And there's more than one salary in there, did you say?
There's a full-time salary, and then you can see the breakdown. There are two positions that $3,000 of that supplements what the county pays. Which is down under salaries.
Oh, down here, I see down there. Okay, yep. Okay, gotcha. Okay, we have that one, and are you recommending it stay the same?
Yes.
Okay. I see three budgets, but there's three listed on the, I see four budgets and only three marked on the agenda.
B is both, it's the local health maintenance fund and the Indiana local health fund.
Oh, so we've actually, without knowing it, approved that. We did the Indiana Health Department and then the Tobacco Trust. Let's just do that one as well. Is there a motion to do the Tobacco Trust grant? Is that, because I didn't realize that those two were the same. So we approved what's on this page one, but we didn't approve the Tobacco Trust.
I'll make a motion that we approve the tobacco trust fund. At the same level,
Okay,
4016.
there's a second.
Second.
And now, discussion?
Yeah, I just had a question. Is it all the same $48,000 annual grant?
No,
or
no.
there's-
The tobacco trust is 32,000.
Okay,
annually.
all right.
So it also gives out of a carryover, which has about 90,000 left in it.
So in the future, it might be helpful to have the side note of that and when for us.
Okay, I'm sorry.
That's okay.
I think this is the clearest we've ever seen.
Yeah,
grant.
no,
Let
right. It's
me
not-
just tell
I'm
you,
gonna take this meeting stuck up on me.
Let me just tell you, for the
It's
8,
stuck up on me.
9, 10 years I've been on, this is the clearest of these budgets that I've seen.
This is a
Like
lot of
this.
typing on my part. If you could see, what I used to send
Yeah.
is what I get that I have to turn back in. So this is.
This
a
is
lot of
helpful.
typing.
Okay, there's a motion and a second, all in favor of the Tobacco Trust Fund grant. 46 remaining the same for 2021.
I move.
Say aye.
It's already moved.
Never mind. Opposed, abstentions, okay, that passes. Now the bioterrorism grant is the preparedness budget. So I wanted June 30th. Okay, so I never knew we had a bioterrorism grant.
We were talking about last year that had come through the state, and there was how it got divided up and other sorts of things. And so what we ended up doing, what I ended up recommending that we do, is that instead of having one or two persons in the department that did all of the terrorism, is that we educate, that we have multiple people within it in the department know about bioterrorism and preparedness and other things, so that if an event did come up, that we're prepared to deal with it. And so we did have one pod that we did practice exercise that we did. And then we had the people with that come together and actually do the COVID testing that we had. So that we spread that institutional knowledge within that. And we're looking, and that's what we did how we divided it last year. This year, we're gonna do it because while that would seem like a good idea, it was too much for people who had other full-time jobs to begin to take on. And so we have one, which you'll see under the bioterrorism, is a group that Bruce Bender. Bruce was in charge of the emergency management agency upstairs, the part of the Homeland Security that's carried us through this COVID epidemic. He had that role and he retired last year. And we have gone to his doorstep, much like I did to Annie, and say, could you please. And he has agreed to head in preparedness state. So he won't be doing what Bob Jackson is doing, taking the money that we get from the state and doing the conferences, looking at the exercise, looking at the supplies that we have, look at the activities that we need to do to have education. And this will help us and then give the reports back to the state that they have milestones that they have. And Bruce will have that next year with this and will hopefully keep us at the same level of sharpness that we
Okay, so I see that we've requested a budget increase.
This is the amount, this is the distribution of the money that the state has given us
Okay.
for preparedness.
So 31,000 for next
Yeah.
year?
And so this is what they have given us.
Okay.
I have one question. You know, there's nothing on training and education.
Nothing on what?
There's no line, there was nothing listed on the line item of training and education under Biopsy.
There is $5,000. Supplies.
And it's not meant, but Bruce is required to have specific training. If he doesn't have it when he starts, he's required to have it through the grant cycle that's complete. I had to take the training last year. Dean has the training. Bruce teaches those classes, so he doesn't have to take the training, but
I guess that's my question, is what training and education is talking about our personnel?
Yeah.
You get that?
The training, and Bruce goes away to teach courses. He will be teaching us.
Okay.
It will cost us.
and he has the training and education that maybe that was meant to cover.
Yeah, I see the confusion like Dr. Renfro. Is this training and education for our people or do training and education for other people?
Oh, no, for our people.
I think that's.
Yes, that's what I was thinking.
It's really for the health department. Okay, got it.
Is it on a July to June because of that's when the money comes in? Or has it just always been that way or like?
It's the way the grant was created. I think
Yeah.
July to June.
I know, that's why I was getting at it, like if you do a 6 month and then, but you can't because that's.
July, that's really a lot of state and the federal government, all of our grants that we apply for are July 1 to June. And it's not in their budget cycle because they start October 1. It's kind of in our budget cycle though. So for us, we go July to June.
And see, county government goes by the calendar year, so it's.
Yeah, so that is hard, yep.
Okay.
Okay,
I don't know moving
no
I mean-
moving.
it.
Okay, we have this budget before us. Need a motion?
Motion to approve.
Second.
Any discussion? All in favor say aye.
Aye.
Opposed? Abstentions, that passes. The last of the new, last of the new items. Any public comment? So at some point, we're going to have a burden for all of these folks that sit here until 6:15 or 6:30. And so at some point, we're going to have that discussion of, do we need all of them to sit through every meeting? Because it's either on overtime or they have to comp time or do something. So I've had this discussion before with Dr. Moore, and I think we do need to have kind of a decision, you know, we have to talk about that. And I'd like to talk about, have that on the agenda for the next time. Maybe, I don't know if that's a executive meeting or not, but, you know, like it's 6:20 and they get off work at 4. So, right? You guys get off work at 4. So I think that we have to figure out a better system than what we're doing, making them sit here. Okay.
I'd
Anything?
like, before we do adjourn, I'd like to officially welcome Dr. Bragg to, I think this is his first meeting, and he's already been instrumental with me in supporting information and other sorts of things. And I welcome you to the board. And thank you for what you contribute, what you do.
Really wanted to emphasize or reiterate the points that superb job leading us through a difficult time. Appreciate your effort.
And I want to say that nothing that I do can be done without the staff here. I can pontificate and other things, but it's these people here that are here who actually have to carry it on. And I thank all of you.
And I have made this comment to Dr. Warren, I'd like to make it public, that I can't see us having gone through what we've just gone through. And so I really, when I think about it, and I've been on the board a long time, so I would say that it's been difficult, but it's been a pleasure working with someone who is so knowledgeable and everything, so with it and with us. So I did tell him that once.
I still have a steep learning curve, and I appreciate the support and encouragement. And never have I felt alone, either because of my staff or because of those that I meet or those that I heard think that each time I called on any of you, that you've always been willing to provide assistance and support, and I very much appreciate that.
Okay. Anything else to come before?
Just one question. Earlier you said that we may need another meeting with the school, so it would be helpful to know what kind of time frame. I'm hoping to take some vacation in July and then maybe others as well.
Well, school starts in early August, so it will. Yeah.
I also take vacation in July, but the time is ticking away, and there's no additional things that we need to have that meeting, and so that as soon as we can do it, everything that we're going to have to be ready as it. I will communicate to the superintendent that we want to have a meeting with them, but I want that meeting to be after the board has met and made recommendations and discussion. There's some difficult issues that we're going to have. That if, for example, the board recommends that there be testing throughout, and it's easy to test, for example, the people that you pay money to. That's an easy one to pay money to have, to say you've got to be tested to be here. That could be a requirement of your employment. The next level of ease of testing that these school superintendents are going to face are those that we would call high risk. Those who are in sports, where they're going to be that droplet spread, they're going to be droplet spread and close interaction and other sorts of things. The next level of ease of testing, as we go down, it gets harder and harder to do, is if we test all of the upperclassmen. There comes an age below which it becomes difficult to do a collection that's done. So that it may be that above a certain age where they can easily tolerate testing that is done. Where does it get done, and how do you get them all done? That's when we get off of the first philosophy. And then the next one is, do we have everybody in the school system, like we require immunizations for all of the kids. You don't come to school, not just for English, but the other people who are there. If they want to play sports, they have to have a sports system. That's a requirement that they have. And in this new pandemic era, that the thing that I want you to be thinking about is the new test, not the brain biopsy, but we have one that's could be in the mayor's, and it doesn't have to be collected by a health professional. A mother can, under the observation of a health professional, collect in her 6-year-old child, have a swab in the nose, but clean out those things that get up in kids' noses, that is sufficient to do it. So, but some people don't want to do that to their kids. Some people are elected in the country and don't have to.
So are we talking about a meeting in the next 2 weeks?
Yes.
Talking about a meeting on the 22nd, next Monday. What are we talking about? I know.
I'm fine. I can make this 1 second.
What about the other members of the board?
Yeah.
I can do the 22nd, but not 5.
Sorry, not a good.
I could do the 22nd, but not at 5 because I'm working out of town.
Probably be here by 6.
Probably we wouldn't have all the staff.
Is having Dr. Miller as being on WebEx helpful for you? Is that an effective and helpful way to be part of the meeting?
It is for me, and the only thing I would say is the audio kicks in and out a lot, except for the main speaker that has been in the center. All the rest seems to cut out in and out a lot.
Are you free with that? This is our IT guy.
Yeah.
I just felt that
Can you do it by WebEx or not?
Driving, just a moment. What
Yeah, I'll be either driving or in a place that has crappy internet, so probably not.
Dr. Miller, what were you going to say?
I was just going to say that because I'm in the place where the most cases are 7 days a week. I've been here 7 days a week since the first week of March. I felt it was the responsible thing for me to try to isolate from as many people as possible. So that's why I've been doing the WebEx here.
Thank you. Thank you for doing that, yes. So 6 o'clock or 7 o'clock?
6 is great. I can do 6.
Thank you.
Honestly, I'll have trouble with 5 too, 5:30 or 6.
I mean,
If it's next week.
I mean, I don't know. I was just looking at the calendar.
Yeah,
Because
no.
this would basically be the only item on the agenda. Correct?
Yes.
So it's not necessary to have all the health department here. Us.
But it would be open to the public or not open to the public?
I don't, and David's not here, but I don't know that if it's to do with personnel issues, I know that we can have it hold. But if we can, I'm not opposed. It's a delicate subject that we're going to be talking about. If we're going to be saying this is the order for the health department, but I share with you the desire to only have it out of public sight if we have to.
To me, I'm not certain that we should. I mean, this is a public situation. It's not a personnel situation. And I don't know, I would imagine that private would feel better if it was private. But I mean, if we're going to come out of that meeting and say, this is what we want people to do without any public anything, I would be very uncomfortable doing that.
And before it occurs, before that time comes, I will try to have talk with as many other superintendents as we can, so we have their input. And I will wear my Kevlar vest and I have the conversation.
I think the superintendents are going to be less like parents. That's when you need to come on less. That's the parents.
Is it your plan to schedule a meeting with the superintendents and following that 22nd?
The sequence was to meet with you and to come with a consensus, and then to see if the commissioners support that consensus, and then to take our recommendation or our position to the superintendents. I think that this pause, having brought it up now, allows me to have some degree of communication with them. And ideally it would be with all of them at one time, but I'm not sure that they're gonna get together at one time. We're gonna have that, we may be able to have a WebEx. I think that something like this, I would feel better talking face to face, but if we can't do that, to have some sort of discussion along this way. Now, again, the traditional way of doing it is what probably the majority of counties are gonna have. If we're gonna differ from what the majority of counties are gonna have, then we need to have a reason why we're doing it. The majority is that you wait until there's a positive and you react to the positive. And if we're gonna do that, then something that I didn't say is that if we do take this more enhanced approach to doing that, we do it measuring the results. And if 3 months down the line, we see no significant increase in cases, then we don't need to continue to be as aggressive towards this at all. But we do it, be willing to learn. Now, this means that we go into the cold weather transition while we're still monitoring. If we get into that cold weather transition, if we don't see something that we're doing that's changing the price of rice in China, and we don't continue to do it just because we started talking about it in July, and we don't continue to do it at a time when it's not really good. We make it as much as possible. We make all of our decisions heavily laden with evidence.
I would suggest to try and reach out to them and kind of get your schedule in mind. Some of us could be at that meeting with you, but some of them or WebEx, whatever you want to plan. And I would suggest we got such a tight window. I would push them on when you think you can, because their schedules are good right now. I know are crazy. They're doing web conferences every day as well.
And I think that they consider themselves equal, so that while there is a person who may on there speaks louder, I'm not sure that they have a leader, but I'll reach out and see if I can find out if we can get a group. And I would love to have not just be my voice, but that.
So could we schedule tentatively for next Monday at 5:30 or 6 o'clock? Could we tentatively schedule
For
that?
us or to talk with the superintendent?
For us.
For us, I heard 6 o'clock, I think. would be the
6
best.
o'clock is
Yes.
better?
So we
Okay,
just set the next meeting at 6 o'clock next Monday.
that would, yeah.
And by that time, I will have at least had a conversation with them to see where they are.
Yeah.
And so that what I don't want is I don't want this to get out in the public and a superintendent gets blindsided by the health department is going to make you do this. I want them to hear about it and to have a chance to engage. And then at some point at a meeting where they can have input with that, it doesn't get them to do.
Is this executive session or public session?
Public?
It would be public. Now, I think one of the things that could be very helpful to all of us is to, again, for that conversation, as you're making contact with the federal superintendent, to invite them to that meeting. It's a public meeting.
And they can attend by WebEx.
Yes. So rather than we make a decision, we take it to them, and then there's this friction, let them be a part of the conversation. So I think inviting, this is going to be a public meeting, and I don't think we have legal grounds to exclude the public, include the medical superintendents up front, the school superintendents up front, be a part of the conversation.
So whether we have to notify people what the topic is, and will it become
Back
back to school?
Yeah, you can talk, what's the state calling it back to?
Education reopened.
Yeah, education reopening.
Yeah. I don't really, not expecting to see a second tobacco discussion. For those of us who were there for the tobacco discussions.
That was
They got kind of ugly.
Yes, but, and you gotta say how many people could actually be in this room.
Oh,
We could have somebody measure out the room and see how can we do social distancing.
Probably 20 people would be moving, besides that.
The commissioners have actually calculated that out, so I'll find out.
Okay. Okay, I would say the meeting is, so next Monday night, you'll send us a little reminder.
Because it seems like that first, second week in July, talk about it, there's gonna be more discussion probably with the superintendents or something. They gotta have something a month ahead.
And yeah, they're open, some of them are open. I'm going to add. Okay, I would say the meeting's adjourned.
Thank you. and
Next regular
Thank you.
meeting, August 17th.
Yeah. August what?
August 17th,
Oh, the regular meeting, yes.
next regular meeting, yes.
Well, unless we have to have 2 more in between. I think they're open.
You know, Wesleyan or Taylor have opening plans that we could build a framework for her.
They've been under a lot of discussion.
There's some way different scenarios.
And even if Indiana wasn't